Bowel sounds are hypoactive. Your bowels are highly vascular. Highly vascular. Okay? Naturally, what's going to happen is if your bowels are receiving adequate amounts of blood supply, it's going to continue to make those gurgly, grumbly sounds. That's normal. Okay, that's normal. Okay, it also means that you're hungry. Right? But it's normal to hear those sounds. Now, if you're not hearing those sounds, okay, there's either something going on with your bowels, or it could also be a good indicator that you are going into shock. Okay, because there is an adequate amount of blood supply to your bowels, they're not going to make those funny sounds. Okay? All right, blood pressure is normal. Blood pressure is normal. This is the compensatory stage. What's going to happen is as shock increases, as shock continues to progressively get worse, blood pressure is going to drop. Blood pressure is going to drop. Okay? Write this somewhere. You got to write this somewhere, okay? Heart rate, okay? Heart rate and blood pressure are inversely related. Are inversely related, which means that if your heart rate goes up, okay, your blood pressure is going to go down. They are constantly trying to keep that equal balance of heart rate and the pressure that it pumps the blood out at an equal level to maintain the same amount of volume that gets pumped out into your vital tissues and organs. It's trying to maintain volume. So if heart rate goes up, blood pressures go down. If your heart rate goes down, what's going to happen to your blood pressure? It's going to go up. Remember that.
So
it's a basic concept.
Sorry, why do you have the blood pressure is normal
Hmm?
then?
Because right now it's compensatory. Like I said, this is just the beginning stages. As it gets worse, this is going to go down. Okay? So in the beginning stages, you may have normal blood pressure or it may start going down. And you will notice that as we talk about the later stages. Okay? Now, your anxiety level is going to increase. And the patient may become a little bit more antsy. He may become uncooperative. Why do you think that is? Because of what? The lack of what?
Oxygen.
Oxygen going to the brain. Remember, the blood goes in all your vital tissues and organs, including your brain. And if your brain is not receiving adequate amount of blood supply, your LOC is going to change. What's the LOC? Your level of consciousness is going to change. Okay? Is this making sense, guys? Okay. So if it progressively gets worse, the mean arterial pressure, okay, we're talking about it over here, is going to start to fall. Okay? It's normal at first, but it may start to fall. All the body systems are inadequately perfused. That means they're not receiving enough oxygen or they're not receiving proper amounts of nutrients. Okay? Including the heart, which begins to pump inadequately. Fluid leaks out from the capillaries. The patient goes into renal failure, and the liver, GI, and heme systems. Now, what we're talking about here is all the, again, vital tissues and organs that keeps you alive. If these organs start to go down systemically, whole body-wise, what is going to happen to you?
Starts to shut down.
Well, your body shuts down, and then you die. Okay? So someone who's going to shock, we got to treat this immediately. Okay? Otherwise, if we don't, systemically, your body shuts down and then you can die. It starts off with one organ, 2 organs, 3 organs, and then when you're talking about whole body, okay, there's nothing there to keep you alive. All right. So the progressive stage is the second stage. Your blood pressure now is going to fall. Your systolic pressure is going to drop below 60 millimeters per mercury. Okay, if we go back over here, your systolic pressure, you see it's between 120 to 140. Systolic is the squeezing, the pumping. Okay, when we're talking about blood pressure, it's going to be, the way it's read is systolic over diastolic. Heart contraction over heart relaxation. So if it is below 60,
It's low.
is that strong enough to push blood out into your body?
Mm-hmm.
That's very weak, okay? So if your systolic is lower than 60 millimeters per mercury, that's going to be a problem. Your respirations are now going to become rapid and shallow. Again, your body is starving for oxygen. You're going to start breathing fast, but it's not effective breathing. Okay? It's not effective breathing. It's not very efficient. So your respiration is going to go up. Severe pulmonary edema results from leakage of fluids from pulmonary capillaries. Because of the decrease in pressure, pushing the fluids through the veins, the arteries, and then the capillary beds, we're constantly putting pressure on there. There is no longer any pressure to push the fluids through, and they start to leak out of the capillaries. Okay? Tachycardia results in maybe as rapid as 150 beats per minute. What's normal BPMs? Okay? 60 to 100. Anything over 100 is fast. Now we're talking about here over 150 beats. It is pumping fast because your body's saying, hey, I'm not receiving blood supply, which is carrying my oxygen and nutrients. So your heart rate goes up thinking, okay, well maybe I can get the oxygen and nutrients to the tissues and organs a lot faster if I pump faster. Okay? So tachycardia is going to happen. Well, patient's going to complain of chest pain. Well, duh. 150 beats per minute, and your heart's not receiving oxygen. Those two things are happening. Not only are you not receiving oxygen, but now your heart is getting overworked. It's getting overworked. Of course you're going to get some chest pain. Okay? Your mental status is going to change, beginning with subtle behavioral alterations such as confusion, with progression to lethargy. What's lethargy?
Tired.
Okay, kind of
sluggish.
sleepy, kind of drowsy, yeah, sluggish, tired, okay. Lethargy, and then possible loss of consciousness. Loss of consciousness. Because again, lack of oxygen going to the brain. Okay, now your major organs are going to have more problems. More problems. See the pattern here, write this down. Someone going into shock. Someone's going to go to shock. Respiration goes up. Heart rate goes up.
Blood pressure goes down.
Blood pressure goes down. Urine output goes down. Those are all your indicators of shock. There are more, but those are your four major indicators. Heart rate and respiration goes up. Blood pressure and urine output goes down. Now, if it progressively gets even worse, now we're kind of at a point of no return. This is the irreversible stage. If we don't correct shock right away, now we've caused irreparable organ damage. Okay? Organ damage and then recovery is unlikely. So we need to act quickly with someone who is going into shock. Okay? Any questions? So in an irreversible stage, your blood pressure is going to remain low. You're going to have renal and liver failure. And then what happens here is your body's going to release necrotic toxins and an overwhelming lactic acidosis. So now as a result, your body starts to release these toxins, causing overwhelming lactic acidosis. Have you guys ever heard that term before, lactic acidosis?
Lactic acid.
Huh?
Lactic acid.
Yeah. What is that?
It's your blood becomes too acidic, right?
It becomes too acidic, but then what's happening? I mean, what is the physical response to that? Muscle cramps.
So you get sore.
Yeah, you get muscle cramps. Okay? This is your whole body going into muscle cramping. It shuts down, and now your body goes into this whole lactic acidosis. Okay? It's a response of it not receiving oxygen And because of the lack of oxygen, you're producing more carbon dioxide, which then causes to happen. Okay? The irreversible stage can cause irreversible organ damage. So some of the causes of shock. Remember the definition of shock. There is an interruption of distribution of blood supply. It's an interruption of the distribution of blood supply or the lack of perfusion. Not being able to exchange the gases or the nutrients. So one of this is bleeding. Okay? Someone who's going under physical or emotional stress has a serious injury or infection, is vomiting or has diarrhea. Okay, the first ones make sense, but what does vomiting and diarrhea have anything to do with this? Dehydration. If you're vomiting or if you have diarrhea, that's why I keep telling you, you need to put back the fluids. What is the main media for your blood cells?
Water.
Water. Okay? If you are not hydrated, those blood cells are not going to go anywhere. Your blood flow is going to be very sluggish, and the blood itself is going to be very thick and very viscous. That's why you need to rehydrate yourself. Okay? Has any form of diabetes. We'll talk about diabetes later on. Is very young or very old, so the young and very old are more susceptible to someone going into shock. Is experiencing severe pain. Has a bowel obstruction. Okay? Is undergoing any procedure that causes rapid decompression of an organ or rapid fluid loss from a body cavity, or has undergone anesthesia. We'll talk about all these different causes here in just a little bit. Let's talk about the different types of shock. Okay, hypovolemic, cardiogenic, distributive, and then anaphylactic shock. Hypovolemic is caused by an abnormally low volume of circulating blood in the body. If your intravascular fluid, again we're talking about blood, decreases by 15 to 25%, or a loss of 750 to 1300 milliliters, then hypovolemic shock occurs. This is a result of an internal or external bleed. You have a bleed, there is a sever, okay, of one of your blood vessels, and now the blood is leaking everywhere else but into your tissues and organs. Okay, this is hemorrhaging. There is a loss of plasma. Again, plasma is, your main media here is water, right? So there's a loss of plasma caused from burns or due to loss of fluids from prolonged vomiting or diarrhea. Medications can cause also dehydration. And then heat prostration is just another word for heat stroke. You've been out in the sun too long. Your body becomes dehydrated. Okay? The clinical manifestations of shock. We're going to break this down into several classes. The first one here is class 1. This is a blood loss of approximately 15%. 15%. Okay? Again, watch the pattern here. Remember we talked about the 4 major conditions. Respiration and heart rate is going to go up. Blood pressure and urine output is going to go down. Okay? So watch what happens here. Blood loss of 15%. Right now your blood pressure is within normal limits at the beginning stages. Heart rate is less than 100 beats per minute. Again, this is normal. We lost blood, but not a lot. The patient is slightly anxious because now there is slight decrease of oxygen going to the brain. Your respiration is going to range between 14 to 20 respirations per minute. Now before I continue, respiration. Respiration by definition is one inspiration and one expiration. It has to be 2. Inspiration and expiration counts as 1 respiration. That is 1 cycle. Okay? So we're talking about 14 to 20 cycles per minute. We're still within normal limits. Okay? Below 15%. Now we go above the 15% up to 30%. Ooh, 30%, that sounds like a lot, right? Okay, so now look what happens. Okay, blood pressure is still within normal limits, okay, but you're going to see this decrease as we progress. Heart rate is now going to be greater than 100 beats per minute. Okay, now your body's sensing, okay, I'm not receiving blood supply, so let's pump the heart a little bit faster. Okay, patient becomes increasingly anxious. Again, no blood to the brain. Respiration is now going to increase, because it used to be 14 to 20. It's now nearly doubled. Okay, because now it's saying I'm not getting blood supply. Let's pump the heart faster. I'm not getting any oxygen. Let's breathe a little faster as well. Is this making sense? Okay. And now your urine output begins to decrease. Okay, because now there isn't any blood supply going to the kidneys. Class 3, 30 to 40%. Now we're talking about almost half your blood supply. Blood pressure begins to decrease. Heart rate goes up. Patient becomes more anxious and confused. Respiration goes up and urine output goes down. You guys see the pattern? Class 4, a blood loss of more than 40%. If this happens and you survive, you're either lucky or blessed, or both. Okay? Systolic blood pressure decreases from 90 to 60. Remember, to compensate for the increase of heart rate, your blood pressure is going to drop. Okay? To compensate for the increase of heart rate, your blood pressure is going to go down. Blood pressure goes down, heart rate goes up. Okay? The patient becomes confused and lethargic. Respiration is now increased to approximately 40 per minute. And then your urine output further diminishes or ceases completely. Okay? At this stage, now we're probably going to reach the irreversible stage. Okay? Now, what is your responsibility as a tech? What is your responsibility with the tech? Remember what we talked about? Stop what you're doing. Get help. Get the crash cart. Be ready to assist. Right? What does it say here? Stop the procedure. Place the patient in a supine position with the legs slightly elevated. Because what we're trying to do here is we're trying to return blood back into the heart. Okay, slightly elevated to get blood back into the heart so they can be pumped into the tissues and organs that are lacking blood supply. Okay, do not place the patient in a Trendelenburg position. What's Trendelenburg?
Where the head's lower than the feet.
This is Trendelenburg, because what we're trying to do here is we're trying to get blood back into the heart, not away from the heart, but back to the heart.
What was the whole reason behind that? Because it's put the blood back to the brain? That was the whole theory behind the Trendelenburg position?
The whole theory about the Trendelenburg is we're trying to get the supply back to the heart so it can pump back. If we have them this way, now we're pulling blood supply away from the rest of the vital tissues and organs, and it's going away from the heart into the brain. So it's not going back into the origin of where the blood supply starts, which is at the heart. Okay? So again, stop what you're doing, place the patient supine, lay slightly elevated, not Trendelenburg. You're going to call the doctor, call for the emergency action, get the crash cart, okay? Make certain that the patient is breathing without any airway being obstructed by position, blood, or mucus. Do we want our patient to breathe?
Yes.
Okay, we want our patient to breathe, right? Because that's where the oxygen comes from. Okay, we want our patient to breathe. If you have a patient who is demonstrating some kind of bleed and you find it, you want to apply pressure to that site. Hopefully by the time they get into your department, the bleeding has been controlled. Okay? But if you see any excessive bleeding, you need to apply pressure to that site to control the bleed, because we don't want them losing the blood. Okay? What should you do before you put your hands on that bleeding wound?
Glove up.
Glove up. Remember, standard precaution. Every time a patient comes into your department, minimum of gloves. Yes?
For the bleeding, can you cut off circulation as well, or would it just be advised to just
Well,
put pressure?
Okay, question is, are you going to cut off circulation as well? Yes and no. You apply enough pressure so that you stop the bleed, but you're continuing the flow. That is something that you will learn once you get into the program. There is a certain amount of pressure that you can apply.
Mhm.
There is such thing as not enough pressure and too much pressure.
Because I was thinking, like, you know how people in movies put, like,
Tourniquets.
that, or like, what are they called, belts around?
Right, that's a
Tourniquet.
tourniquet, yeah,
Yeah.
tourniquet, yeah. Yeah, to stop the bleed,
Mhm.
right. Because again, what we're trying to do is controlling the amount of blood that they lose.
Okay.
What's the whole theory? Life over limb.
What's that?
Life over limb, right?
Life over limb. Right, life over limb, exactly. Okay, so again, here's the pattern. Prepare to assist with oxygen, IV fluids, and meds. Now, is it within our scope of practice to administer medication?
No.
No. Whose practice is that?
Nurse or doctor.
Nurses and doctors. We are there to assist. And that's why you need to be familiar with the crash cart. Because if they ask for epinephrine, okay, vasopressin, lidocaine, bicarbonate, you know where to get it. Okay, so be ready to assist. Keep the patient warm and dry. This is the key, warm and dry. You don't want to overheat because you're going to increase metabolism. And when you increase metabolism, you need oxygen. Okay? Well, they're already lacking oxygen. So what you're doing now is you're taking or depriving them of the oxygen which they have. So you want to keep them warm, but you don't want to throw a whole bunch of blankets on them. Okay? You don't want to do that. Take vital signs every 5 minutes and do not leave the patient unattended. Okay? Keep them informed to prevent any type of anxiety because again, that can increase the shocking condition. Do not offer fluids to the patient because there is a possibility that they may need to go to surgery immediately. And we want to make sure that they have an empty stomach when they go into surgery. Otherwise, if they have contents in their stomach and during surgery, some of that contents when they come up, go back into their trachea and into their lungs. Okay? That's called what? Aspiration. Okay, so we don't want our patients to aspirate during a medical procedure. Any questions so far? Okay. Cardiogenic shock. Again, shock is shock is shock is shock. What we're discussing here is the origin of the shock. Hypovolemic, again, is a decrease of volume due to a bleed. Okay, it could be vomiting, it could be diarrhea. Okay. Here, okay, that's lack of volume. Here is cardiogenic shock. Before we even discuss the definition, let's break this down. Cardio.
Heart.
Genic.
Origin, right?
Origin. So this originates from the
Heart.
heart. Okay, cardiogenic shock. This is caused by a failure of the heart to pump adequate amounts of blood to the vital organs. Failure of the heart to pump adequate amounts of blood to the vital organs. Some of the causes includes a heart attack. Okay, that's a myocardial infarction. It's a heart attack. Cardiac dysrhythmias or other type of cardiac pathologies, right? It originates from the heart. The initial complaints of the patient will be of chest pain, which then irradiates to the jaws and the arm, usually on the left side. They may be complaining of dizziness. Okay, why? Okay, no blood going to the brain, or respiratory distress, because again, now your body's saying, I need oxygen. So now they're going to breathe a little bit harder. Is your heart a muscle, by the way?
Yep.
It is a muscle, right? Does it receive its own blood supply?
Yep.
Yes, it does, okay? So if the heart is not receiving its adequate amounts of blood supply, what happens to the heart muscle?
It starts to die.
It starts to die, and if it dies, then what happens to you?
You die.
You die, right? So cardiogenic shock, again, shock originating from the heart. Some of the clinical manifestations include cyanosis. What is cyanosis?
A blue color to the skin.
Okay, bluish color to the skin. Bless you. Due to the lack of what?
Oxygen.
Oxygen. Okay, blueness usually occurs around the lips, around the tongue, the earlobes. Okay, fingertips. Those are the obvious signs. Okay, lips, earlobes, tongue, fingertips. Restlessness and anxiety. Okay, no blood to the brain. Rapid change in the level of consciousness. The pulse may be irregular and slow, and they may have tachycardia and then tachypnea. So again, we're talking about increased heart rate, increased
Breathing.
respiration. Okay. Decreased blood pressure, and then also decreased urinary output. Your skin may become cool and clammy because, again, lack of blood flow to those particular areas. Okay, what are you going to do? Stop what you're doing, get help, get the crash cart, get ready to assist. Okay, again, never ever leave your patient alone. You're going to take your vital signs every 5 minutes. And then you also want to sit them up. Why do we want to sit them up? Okay, if it's cardiogenic, okay, their heart is already deprived of oxygen. So when you sit them up, this aids in their breathing. Your diaphragm is going to automatically want to drop. Your lung area starts to increase, and therefore you have more air intake. Does that make sense? So we're going to sit them up. It also helps relieve some of the anxiety that they're having to deal with. Okay? And then if worse comes to worse, be prepared to perform CPR. Now, I had a patient, this is actually a couple weeks ago. We had a patient who came in with full cardiogenic shock. He was having a full-on heart attack. It was kind of ironic because they found him down, unresponsive. Okay, they found him in a cemetery. Okay, come to find out later, he worked in a cemetery. Okay, but they found him down. Came to our department, full-on code, full-on cardiogenic shock. So we were starting to perform the catheterization of his heart vessels to see where the blockage is. Someone's having a heart attack usually means one of the major vessels has gone down. Your heart vessels is what feeds the heart. Okay, again, the vital oxygen and nutrients. So now the heart's being deprived of oxygen and nutrients. So we do an angiogram to see which vessels are blocked, and we go there and fix it. Well, first, so what we're setting him up, okay? And as we're setting him up, he regains consciousness. And I remember as we were prepping him, so I was getting everything ready. We had the scrub tech getting his table ready. The doctor was waiting on the wings, ready to come in. And as we were setting him up, I remember him regaining consciousness, and he looked at me, and I remember saying to him, everything is going to be okay. Everything's going to be fine. We're going to take care of you. Okay? His heart stopped beating right at the beginning of the procedure, and then we had to do chest compressions. So this was me doing CPR. Okay, so here I am standing on top of him doing chest compressions. I remember cracking all those ribs as I'm doing that. Okay, but I knew my compressions were good because I'm also looking at the monitor which he's hooked up to, and I can see his heart volume going up where it should be with each compression that I'm doing. So his body was still receiving adequate amount of blood supply, but his heart was already damaged and it already suffered from that heart attack. Okay, and he was just too weak to regain consciousness. And we call off the CPR after 15 minutes of chest compressions. Okay, but that was it. I mean, I remember, like I said, the last thing I remember was him looking me in the eyes, and I was telling him everything was going to be okay. That was probably, I've experienced several deaths working in the cardiac cath lab, even in X-ray. I would say a total of maybe half a dozen. Okay, in my career, I've been doing this for close to over 25 years.